Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Michael Taipale. We are so excited to have you this morning. Thank you for joining us.
Thank you so much for having me.
Of course. So today we are talking about blood pressure. First, doctor, tell us what blood pressure is and why is it so important?
So every time the heart beats, the heartbeat generates pressure inside the body, inside all of the blood vessels. And the maximum pressure is that top number of blood pressure, or the systolic blood pressure. The heart then relaxes and fills up with blood. The pressure gradually decreases throughout the body, and that gives you the lower number, your diastolic blood pressure. The reason it's so important, if the blood pressure is too high, it puts stress on the body and stress on the blood vessels. And that stress increases the risk of some pretty bad complications, things like heart attacks, strokes, aneurysms, blockage in the arteries in the arms and legs. So it's really important to keep things under control to reduce the risk of developing those complications.
Okay, so what are some long-term risks of uncontrolled blood pressure?
The same kinds of things. We run into risk of having a heart attack, having a stroke, worrying about blockages in the arteries. All of those things can come from having too high of a blood pressure.
Right, you know what, doctor? Many people say that their blood pressure is higher when they're at their doctor's office. You know, when I get there, my heart always seems to beat out of my chest as well. So why is that?
So that's very common. A lot of times the doctor's office isn't the best place to take the blood pressure because invariably people are nervous being at the doctor and it's rushing in. Maybe you're running a couple minutes late, couldn't find a parking place, trying to run in from the parking lot. All of those things can raise blood pressure. Really, to take a good blood pressure, you want to make sure that you're calm, relaxed, sitting down and resting. We usually tell people to rest a full 5 minutes before checking their blood pressure. You also want to make sure you're avoiding any sort of stimulants. Things like caffeine, exercise, or even smoking cigarettes will all raise the blood pressure. You should really avoid those for at least 30 minutes before you check your blood pressure. And you also want to make sure you're using the appropriate equipment. You want to use a good-sized blood pressure cuff to really make sure you're getting an accurate number.
So a quick way to just step-by-step to check it at home would be how, doctor?
So you want to ideally find a nice, calm, relaxing spot where you can get away from the stresses of life. Try to sit and relax for at least 5 minutes. You want to make sure you're resting your arm on a table or the arm of your chair, and try to have the blood pressure cuff right about the level of your heart. After you wait for about 5 minutes with your feet firmly on the floor, check it at that point. You could even check it 2 or 3 times and then average the numbers, and that'll give you a better idea of where the blood pressure is as opposed to running upstairs, throwing it on, and checking it really fast.
Yeah, well, that's very helpful. Okay, so if someone has high blood pressure, doctor, what should they do?
So there's lots of different things we can do. Obviously, we have a whole lot of medicines that we can use to try and help lower the blood pressure, but there are things you can do on your own. Things like trying to lose some weight. Losing 1 kilogram or about 2 pounds can lower your blood pressure by about 1 point. Trying to avoid salt in your diet can really help reduce blood pressure as well. Eating a low-salt diet can drop by up to 10 points. Increasing your daily activity, trying to get between 90 and 150 minutes of exercise per week can lower the blood pressure by about 5 points. And then decreasing alcohol use also can help decrease your blood pressure. Usually we say about 4 points just from cutting back.
Well, doctor, we can see you're very knowledgeable and very passionate about what you do. Tell us why you love what you do, doctor.
You know, it's just so much fun to get to talk to people and really make sure that we can help people feel better, and ultimately that's the goal, is getting people to feel better, but also getting to share in their experiences and hear stories, and just getting to interact with people is really the best part of my job.
I'm sure that's so rewarding, making people healthier and living a healthier lifestyle. Thank you so much for calling in today, doctor. We appreciate it.
Oh, absolutely. Thank you so much for having me.
Of course, you're welcome. If you'd like any more additional information on today's topic, just head on over to the Hot Links page. That's on WNEM.com.